John Bozica, 1480 WHBC, talking to you live right now from OMNI Orthopedics over in Belden Village as part of our healthcare week that we are bringing to you all week here on 1480 WHBC. We spent yesterday at Here Inc. We're spending today at OMNI Orthopedics. We're going to talk to individuals tomorrow from both Altman and Mercy, and then on Thursday we'll be at Green Compassion Network, and Friday we will be live from Akron Children's Hospital. But right now, we bring in Dr. Matthew Stonestreet, who is our next guest, and he is a board-certified orthopedic surgeon specializing in adult reconstructive hip and knee surgery. And Dr. Stonestreet, thanks for stopping by.
Thank you. I appreciate it. Thanks for being here today.
Absolutely. So I'm looking at the notes they gave me on you, and looking at what I've written down here as well. And the thing that always pops off the page anytime you see it is robotics. And you use robotics in, I guess, helping to replace hips and knees. And I'm curious how this works, what this is, and why people listening should be interested in this.
So, yeah, I use the Mako robotic system for hip and knee replacement. It's a... Am I still on? I can't hear me.
Yeah, you should be good. You're good. I can hear you.
Okay.
Now can you
He's
hear
good.
me?
I can't hear me through here. All I hear is me through
Okay.
my voice.
Just take the headset off. You're fine.
Okay. So, sorry about that. Yeah, I use the Mako robot, which is a Stryker product for hip and knee replacement. The kind of the theory behind it is that the robotic technology, the way we use that is we get a CAT scan beforehand. So then the CAT scan gives us kind of a 3D picture of that hip or that knee, depending upon what we're going to be doing. And from that picture, then that goes into the program for the robot, and then we're able to take the implant that we would normally use in surgery, and in that computer program, kind of put that implant exactly where we want to put it. And then we can adjust that in 6 degrees of freedom. So in a knee, we can take more bone, we can take less bone, we can take more bone off the femur or off the tibia. And then we could rotate things, but we can change things within about a half of a millimeter of accuracy, and then reproducibly enact that in surgery. And so what that allows us to do is much more accurately and precisely place the implants, which in a perfect world and in theory would allow us kind of to more reproducibly or more closely reproduce the biomechanics of the knee or the hip from what would quote-unquote be normal initially.
So when did this new way of doing things kind of become commonplace for you, and how long have you been working with this now?
So for me, I've been doing it for about a year now. I do as many of my knees as are willing to use that technology, really. And the hips I don't use quite as much. It's more of an access issue than anything. Yeah, I've used it for as many of my knees as I can, and use it pretty exclusively for my total knees at this point. And I've been doing that for about a year. The total knee system itself has been around for about 2 years. I think 2017 or 2018 is when that initially rolled out. But robotics has kind of been a field that's been developing over the past, say, 5 to 10 years. And I think this is kind of the tip of the iceberg for us.
He's a board-certified surgeon in both constructive or reconstructive hip and knee surgery, and that is Dr. Matthew Stonestreet, who joins us right now on WHBC from OMNI Orthopedics. Dr. Stonestreet, when it comes to actually having this technology now at your disposal, I mean, has it made you a better doctor, you feel, that you have this, or did you feel like you were still pretty precise beforehand, or has this even made you more meticulous in how you've gone about this process?
So I think that's the biggest question with robotics right now is, does it make us better, and how much does it make us better? I would say from a personal experience, I think that going kind of back and forth between traditional total knee and total hip replacement and robotic total knee and total hip replacement, that I do see differences in things that I feel like I can catch. A lot of that comes with volume. So one of the main goals of robotics is to kind of eliminate outliers. Because even in high volume settings, there are some outliers in terms of implant position that you may or may not want, and this reproducibly takes those away. So you can almost, without getting an x-ray, know that you're putting your implant exactly where you want to put it every time. So I think that helps outcomes. And I do think that it kind of helps train your eye some. I'm not going to say that I can see the same changes that the robot can, but I think it does allow you to kind of learn a little bit from it.
So I guess that's always been a question of mine is how smart is the robot? Like how does the robot factor in like human existence and stuff, or is it pretty much just is what it is? Go ahead.
So robotics is kind of the buzzword. It is a robot in the sense that it's a tool, but it's not like it does not think on its own or do anything on its own.
Okay.
Its main role is to stop us from varying outside of the kind of input parameters. So the robot simply is a saw that is attached to an arm. And then we put sensors on the knee or the hip so that the sensors kind of know where that is in 3D space, kind of like GPS technology. And then the saw also has sensors in it. And then we put the pre-planned cuts in. And as we're making the cuts, I'm controlling the saw in terms of whether it's on, but where I'm going, but it stops me from making cuts incorrectly to, like I said, within about 1/2 of a millimeter. So if I start to stray in any way whatsoever, it just shuts off. So it's not thinking independently or doing, but it's stopping me from straying from because we make the plan. So the robot's not making the plan or thinking on its own or adjusting live. It's just doing what we tell it to do. So I liken it to it's a tool to just try to make us a little bit better. So it's not something that is taking the place or doing it on its own or learning from us, but it's just a tool that we can reproducibly put things in much closer than we can without it.
So it's not like the HAL that we see in 2001: A Space Odyssey. That's like, sorry, I can't do that, Dr. Stonestreet.
No, yeah,
no, not like that at all.
It does not speak to me, nor would I want it to in the operating room. But
well, it looks like you made a mistake there, Dr. Stonestreet. You wouldn't want that, would you? Dr. Matthew Stonestreet, board-certified orthopedic surgeon specializing in adult reconstructive hip and knee surgery. Dr. Stonestreet, fascinating stuff. I appreciate you joining me and look forward to talking again soon, all right?
All right. Thanks a lot. Once again, thank you for coming out.
Absolutely. We'll take another break. We'll come back and have Dr. George Papakostas join us as he is a board-certified orthopedic surgeon specialized in general orthopedics. That after this.